Another Webinar Wednesday. Today we are joined by Jeff Evans, Chief Commercial Officer at PartsSource. Webinar Wednesday would like to thank PartsSource. With the mission of ensuring healthcare is always on, PartsSource empowers owners and operators of mission critical equipment to maximize clinical availability and patient therapy, while achieving sustainable savings and efficiency. So for more information, please visit partsource.com. Now, just a quick reminder about our Fall MD Expo, which will be held at the Renaissance Dallas Addison Hotel in Dallas, Texas, and that's from November the 10th to the 12th. So please join us for 3 days of education, networking, and the latest advances in medical technology products and services. For more information and registration details, please visit mdexposhow.com. Okay, today's webinar, as usual, is eligible for 1 CE credit from the ACI, and you can obtain your CE certificate by completing the post-webinar survey, which will be emailed 1 hour after the completion of today's webinar. You must complete the survey to receive your 1 CE credit, and you'll be able to download the certificate directly from your computer once the survey is submitted. If you have any questions, you can reach us at webinar@mdpublishing.com. Let's kick off today's webinar by giving away a Swiss Force Meister multi-tool. So using the questions feature on your dashboard, let me know the answer to the following trivia question. October is National Apple Month. Which state is the largest producer of apples? I'll reveal the answer and our winner at the end of the webinar. We'll be wrapping up today's presentation with a live Q&A, so please submit your questions anytime using the questions feature on your dashboard. Now, as I mentioned earlier, our presenter today is Jeff Evans. So Jeff, you may begin whenever you're ready.
Hey, Linda, thanks so much. And good morning, good afternoon, everyone. Linda, big thanks to you, MD Publishing and TechNation, for being able to have us on today. For those that I haven't met, Jeff Evans, I'm the Chief Commercial Officer at PartsSource. I've been a part of the services and HTM community for over 20 years. I spent about 17 years at GE Healthcare in a number of roles. And then over the last 3 years over at CAE Healthcare, running that organization on the healthcare simulation side. So a pretty cool little niche business that we sold last year and got the opportunity to join PartsSource over the summer. And so as we think about what we're really going to get into today, we'll do a high level just overview on PartsSource for everybody, just to ground you if you haven't had the opportunity to work with us in the past. We'll go through some of the current trends. Obviously, there's a lot going on in the HTM environment, a lot of volatility going on, obviously, across the country and geopolitically. We'll talk a little bit about current trends and what's been going on there, and then talk a little bit about things that you all have to think about on a regular basis, and how do we think about like this evidence-based approach to continue to think about, you know, cost efficiency, productivity, and truly driving resilience across your teams to deliver what you need to on a regular basis. And so with that, we'll dive a little bit into PartsSource. If you haven't had the chance to work with us in the past, we continue to be the leading technology platform for managing mission critical healthcare equipment, and a bit of our tagline in regards to ensuring that healthcare is always on. As you can see from the bottom, we continue to work with leading health systems across the country. We work in the academic space. We work in, you know, rural and community hospitals across the country. And then we also work with ambulatory providers, labs, as you think about higher education and universities. And then also government organizations like the CDC that continue to entrust us to help support their critical equipment. What we do is we really take a single enabled parts and services platform that enables HTM groups and operators to gain efficiencies and really drive costs down. And you know, that proven methodology over the last 20 years has really helped support, right, cost, quality, productivity, and with decades of proprietary data really dedicated to serving your organizations to really focus on total cost of ownership and delivering lifetime value. That's in a setting that's not only multi-vendor, but multi-modality, and then in a multi-site type of environment. You can take a little look around the wheel here as we think about what that comprehensive solution truly looks like. We've been in the parts space for a number of years. this organization has truly grown over the last like 15 years or so to become much more of a comprehensive solutions organization for the HTM community, not only dealing in parts, but also looking at how do we really focus on service and taking cost out across the HTM environment. That could be with our services network as we think about not only OEMs, but also ISOs to drive capitated models that truly have transparency back to you on what the true cost is for service types of events and the opportunity for share back at the end of the year. It really truly puts us on a same collaborative playing field with the HTM teams that we work with as you continue to try to take a look at insourcing and driving out costs in your organizations. We also know that, you know, insourcing is a journey. We've looked at acquiring companies over the past couple of years to help from a talent and a training perspective. We acquired RSTI out of Ohio, which is one of the largest multi-vendor training centers across the US, really to help support that effort. And then earlier this year, purchased a company called Invert. Invert deals in the mixed reality space. We know in HTM, there's a tremendous amount of opportunity as we think about what mixed reality can bring to bear for on-site training and continuing to get better as we think about the higher modalities that you actually go through. And then brings into effect really what we think is the future as you think about augmented reality and how not only looking at a piece of equipment, but having somebody in your ear to be able to guide you through services allows lower level technicians to be able to do higher types of services on a regular basis, really driving down the cost of service over time. All of that really, you know, comes through in regards to the digital and the data that you have at your fingertips on a regular basis. The opportunity to have real-time information to asset uptime, cost reduction opportunities, and then really taking a look at asset utilization, which really helps you all take a look at how do you partner with department colleagues to drive more revenue for the organization. We've had you know, a number of conversations, and we work specifically with HTM leadership. If we go to the next slide, HTM leadership is where we've obviously been focused for a number of years. We continue to have more discussions with executives across the hospital space, CFOs, supply chain leadership, COOs, to holistically take a look at driving cost out. And then more and more taking a look at you know, IT leadership as HTM and service organizations come under IT. As well as the integration point of your CMS and your ERP systems with our, you know, single platform to create a seamless procurement process across both parts and service. And so we appreciate all of the ongoing dialogue that we have with all of you as we think about lowering the cost to serve, and obviously a huge issue across healthcare as we think about costs across it. If we were to get into the next section a little bit, we talk a little bit about trends impacting operations and clinical capacity, the things that you all have to deal with on a regular basis. I'd like to pause for a second here and go ahead and pull up a poll if we could. If all of you could go ahead and get into the platform here and go ahead and give us your feedback in regards to, you know, what challenges you're seeing and impacts you the most as we get into 2025, escalating costs in clinical and supply chain operations, persistent staffing shortages impacting efficiency, increasing demand for uptime and patient safety, and then the last one on here, this whole digital transformation and the goals that you have across your organization outpacing a lot of the current capabilities that we have at hand. So Linda, I know you're getting some inputs as they come in. I'll pause for a second and then take a look at what the results look like.
Okay, Jeff, I'm going to give them a couple more seconds, then I will close the poll. Okay. Right, you should see the results, Jeff.
I do. Not a big surprise from my perspective. We hosted a leadership summit, had about 60 of our clients down in San Antonio last month, and I think a lot of this came out as a part of those discussions as well. Staffing shortages as they continue to impact the efficiency that you have, being forced to do more with less. And then obviously the escalating costs in clinical and supply chain operations also coming out as well, whether that's inflationary dynamics that we've got across the country, or some of the legislative and tariffs that we've seen as we've gotten into 2025. So not a lot of surprises here. I'll touch on a couple of these as we get through the next few slides. I've been a part of this HTM community for the last 20 years or so, and over the last 10 years, I give this group just a tremendous amount of credit, because the challenges that you've had to continue to deal with over the last 10 years, they're many. On top of deteriorating margins, which really started back in 2005 with the Deficit Reduction Act, you've had to really go through this like massive digital transformation, which on one side is really good as we think about productivity and how we gain more efficiency across the organization. But at the other point of that is really like the change management that comes along with it, and really working through that daily, weekly, quarterly to be able to get your organization where you need to go. COVID, I always laugh. I'm pretty sure it's 2 years that all of us want back in our lives. But the one thing that it really did was it exposed how fragile our supply chain truly is, not only in the States, but globally. And what that really means as you think about turnaround times for what you are trying to do to, uptime for clinical assets on a regular basis. We'll talk more about labor shortages. I believe it was your number one in regards to the poll. That is a huge deal that we've got to continue to think about differently over the next couple of years. And then, the one that always comes up is manufacturer priorities. And, the high cost as you think about single socket, as you think about service contracts, as you think about maybe the misalignment sometimes as we think about what their priorities as publicly traded companies are and what you're trying to do on a regular basis. And so with that creates challenges as you're buying new assets and obviously trying to service aging assets as well. If we were to go to the next slide, 2025 has, continued to throw more challenges at you. It's been a roller coaster of a ride as we've thought about, the United States specifically. Declining margins have continued to hit, what that looks like for the healthcare environment. A lot of that due to rising expenses that you see in the middle here, not only on the labor side, but on the non-labor side as well. And then labor shortages across healthcare. A big piece of that being in the HTM space. The recent study showed that over the next 2 years, 2,000 HTM technicians will retire, only to be backfilled by 1,300 that are coming out of school. And so that ongoing deficit that you have in regards to labor shortages in the HTM environment is only going to get worse over a period of time. We're going to go to the next slide and talk about a few more key trends in healthcare technology management. This inflationary environment that we've seen over the course of the last few years since COVID has really put challenges on the bottom lines into all of your budgets. You can see, labor, parts, and service agreements anywhere in between 20 and 40% increases over the course of the last 5 years. Parts and service agreements being probably the highest pieces of those. We at PartsSource have done our best to continue to drive down inflationary, effects on the market. Our buying power that we currently have allows us to do some of that and not pass that through to our customers. And then really looking at how we continue to focus with in-house groups on insourcing has also helped us kind of really heat off some of those, the service agreement inflationary costs as well. You all are having to deal with obviously a much more complex footprint. We've seen this for a couple of years now. And then over the next 5 years, we know that, US hospitals and the main acute facilities are going to continue to decrease, and there's going to be this continued increase in ambulatory facilities, surgery centers. But what that means for you is the ability to, go out in a, more disparate type of environment and geography to be able to take care of those assets, which is not necessarily always easy as you think about labor within your organizations. And then as we think about asset lives, I would love to say that it's only a 2 to 3 year increase that we've seen. This is for MR and CT. I think we all think about like the low modalities or X-ray and ultrasound. That's even increased further in regards to extended life of those assets, which just makes it harder, obviously, to be able to find parts, find contracts, find the things to keep those assets running longer. Maybe off the cuff here, what I would love to do is on top of Linda's, giveaway today, I'd like to give away a $100 gift card ourselves. I'll make sure I come back to this at the end, but feel free to go on to LinkedIn, find me, connect with me. I will give a $100 gift card to whoever sends me a picture of the oldest asset that you currently have to service today. And I know there's some old ones out there. So we'll have some fun with that. I'll get that out on my LinkedIn profile over the course of the next 24 hours who the winner is. So oldest asset that you have to service as it sits today, hit me on LinkedIn. I'll get you a $100 gift card for whoever has the oldest asset. As we continue to think about, HTM reports, we do a lot of research ourselves. A lot of the things that you see on here we've talked about previously. The other one that was really a hot spot for folks, as I talked to, HTM leaders in San Antonio at our leadership summit, was really this challenge on influencing, internal leadership peers and getting a seat at the table as you think about capital asset purchases. I just can't stress how important that is. It's a really big deal as you plan out what your in-house strategy looks like, as you think about your overall service strategy, as you think about OEM warranties, contracts, ISO contracts, the ability to sit at a table and be able to articulate what that looks like so that your cost of serve over time goes down, not up, is a really big deal. You can see up in the top right-hand corner, there's a bit of a screenshot here. We are putting together a state of the healthcare technology management industry that should be out late October, October 28th, I believe, is when that's coming out. We will make sure that this group has access to that in the future. You can see even more of the trends across the industry and really what's going on as it comes through that HTM report. With that, we'll go ahead. A couple additional trends and things that we're seeing in HTM as well. This thought process of predictive analytics, the feedback of sometimes you have very little data to do what you need to on a regular basis. That's even, further exacerbated as you think about predictive analytics. And I think all of us want to get to a steady state of where you have predictive analytics, when things are going to break, and proactively you can get parts delivered and be able to take those things down off hours versus on hours. That'll be a really big deal. The average number of contracts across the country for an individual organization, really vets out somewhere about 150. And so the ability to think about all those contracts, to think about managing all those vendors is something that, is really challenging on a pretty regular basis as well. And then, 42% report, developing and upskilling biomedical technicians is really a top priority. It has a lot to do with labor shortages. It has a lot to do in regards to holding people within your organization and career pathing. And there just aren't enough dollars and enough time to be able to do a lot of that work. And so, we've had some steady progress for a number of years, but obviously it's, it can come up short or feel that way on a pretty regular basis. I really want to end this in regards to just thanking this group for what you do on a daily basis. this dual mandate that you have around resilience to serve and cost efficiency. At the end of the day, this like just feels like do more with less. And I applaud the HTM community because it's been going on for a number of years now. And I do think there's an opportunity to continue to think about how do we utilize data and analytics? How do we think about a single enabled platform that really focuses on multi-vendor, multi-modality, and multi-site to be able to really drive costs out of the system and make you all more efficient. With that, we can get a little bit into just a few things that we think about on a regular basis as we think about leveraging technology, as we think about leveraging data. Where do you spend most of your time? We talk a lot about data-driven, evidence-based, and tech-enabled. You spend a lot of your time chasing hundreds of fragmented suppliers, distributors, and OEMs, frustrated with manual processes that are disconnected many times to the tech solutions that you have in place today. And many times, like I stated before, you're really blind to either poor data or no benchmarking data at all. It leads to variable outcomes, it leads to overspending, it leads to inefficiencies across HTM, and then obviously there's a clinical side to that from an uptime perspective that really matters. We think about the what side of the equation to how to do it a little bit more efficiently. This thought process around a single enterprise platform that streamlines workflows, gives you back time to give top of license back to you to go do the clinical things that truly matter and really focus on uptime for your clinicians. Comes with evidence-based benchmarking, the data to think about how you procure not only assets, but how you think about parts and service, how you get the right part at the right time is a really big deal for your organization. As you think about wider sites, wider biomed teams across the organization, how do you standardize that through formulary management, really algorithms that enable you to make choices for your organization that really, takes away what many times happens is people that put in hours of time, which is hundreds of dollars for the organization from a labor perspective, only to save like $50 or $75 on a part. And so formulary management that standardizes which part to buy for your sites, for your technicians on a regular basis, and really saves total cost of ownership. And then as we really get to this point of community-based purchasing power, we have 100,000 events on an annual basis that allows us to take that purchasing power and deliver it back to you on a regular basis to really drive costs down over a period of time. And then as you think about the maturity of your all's organizations, it gives you the opportunity to really think differently around, being very reactive to getting into being, proactive, strategic, and being a thought leader in the industry. A couple of questions that I always pose to people that really start to get up this, chart, so to speak, is, do you know and understand all the spend that you currently have today in all of the contract data that you have today? And do you have a good understanding of how to try to drive that down over a period of time? Do you have KPIs to drive your business on a daily, weekly, monthly basis? That's a really big deal to really hold, I think, ourselves and our organizations accountable to really becoming more efficient and taking costs out. Do you continue to think about how in-source labor drives continuous improvement? When you get to the answer of some of those questions, it really gives you the ability to shift from reactive to proactive. And what you can see on the left-hand side is it really starts to drive cost of service down to what we feel is world-class, somewhere in the 3 to 5% range. Total outsourcing, contracts with OEMs, that sort of thing, truly drives, something in the 10 to 15% range. When we get to be thought leaders in HTM, we really drive down our cost to serve over a period of time. And so I always pose the challenge a little bit as a part of these things. Where do you put yourself on the list? And really what's getting in your way on a regular basis is being a thought leader to really think differently about, how we really move the ball forward. So with that, I don't want to take more of your time today. I know everybody's got busy schedules. It shows a little bit on the things that we're thinking about at PartsSource that align to the challenges and the trends that we're seeing in the market. I think on a pretty regular basis about the outcomes that you all have to deal with and that you deliver. How do we think about operational efficiency, and how do we provide more of that to you all on a regular basis? Again, that comes with a connected platform. It's with data and analytics that standardize sourcing and service and data into one environment for you all. It really drives financial performance as you think about the standardization and how you leverage really that buying power on a regular basis. And then the clinical aspect of it matters. It matters to your technicians to get them back to top of license to be able to fix things on a regular basis. And then it matters to the patients that your organization serve as you think about the uptime for that equipment and the outcomes that those patients get as they come to your organizations and what truly matters. And so with that, I want to thank everybody for the opportunity for us to be with you all today. There's a few contact points on here. To learn more, please feel free to reach out to us at PartsSource with a couple of links here provided. I would love to see some of the pictures and some of the aged assets that you all are having to deal with. I will get out who wins the contest tomorrow morning. So hit me up on LinkedIn. My profile at Jeff Evans 97 is there. And then obviously feel free to join us at MD Expo in Dallas here in November. We'd love to see you. We'd love to continue to have conversations with you all to be able to support and help what you all are trying to do in the HTM space. So with that, Linda, I know that we've got probably a few questions that are out there, and I'll turn it over to you to walk through that a bit.
Perfect. Thanks, Jeff. We've got a couple of questions. Yes. Now, the first one is, what role does data play in your organization's ability to standardize procurement and improve uptime performance?
Yeah, it's a great question. We mentioned it a little bit in the midsection here. The ability to have data to take a look at what is the service history. We've got about 3 billion data points over the course of the last 20 years that really help us look at what are the right parts, what are the right vendors, what are the right service offerings and service providers, and what does that quality look like over a period of time. That's a really big deal in regards to being able to make data-driven decisions for your organizations. And then I think data will help us, and specifically as we think about the world that we live in right now as artificial intelligence and being able to gather that data and do more with that data, thinking about what predictive analytics actually look like. We're doing a lot of work in that space right now to be able to provide service technicians and organizations to be able to get ahead of some of those uptime disruptions. And then really on the backside of that, there is always been the conversation around service costs specifically, whether that's contracted costs, labor costs. There's the other half of that equation as well, which is truly the capital equipment replacement cycle. And if we can continue to get engaged and have a seat at that table, driving the utilization up of the assets that we have across the organization, and frankly, making fewer replacement costs over a period of time is going to look at total cost of ownership over time and truly drive down that overall cost equation. So it's a great question. We've got to continue to get data in the HTM space and continue to use it on a regular basis to be able to drive the outcomes that we really want.
I think that's great. Now, another one here is, what changes have you seen in how your teams manage service contracts or sourcing parts?
Yeah, I think it's been, really interesting. We've seen a pretty dramatic shift over the course of the last 5 or 6 years based upon all of the trends that this group has really, had to be challenged with over a period of time. I think thinking about not being as reactive and having fragmented approaches across the continuum is a really big deal. Thinking about what a strategy looks like over not only the next 12 months, but the next 48 months is how we think about getting off-service contracts. How do we insource more of the work that we do? How do we think about like the time that it takes to be able to get people into training, to be able to get into in-house types of contracts or parts-only types of contracts, which lower cost of serve? All of that dedicated time and the ability to take a step back and put that training plan together with the data that shows you what are the right modalities, the right OEMs, and the right contracts to really affect next and over a period of time is really the right way to approach it. And so we're seeing a lot of that work. We're doing a lot of that work in collaboration with our HTM partners, and would obviously offer it up to this group as well, Linda.
Great. Okay, so before we wrap up today, Jeff, have you got any top tips or anything you'd quite like to summarize?
Yeah, hey team, I will just leave you with this. I think 25 has been a really interesting year, on top of a number of interesting years, so to speak, as we've gotten through COVID in the last 10 years in the HTM space. A lot of challenges that you all have had to deal with. I would say, we get into the day-to-day execution mode. It's where it takes us every morning with broken equipment and things that are down. I think the ability to take a step back and really plot out a course that does all the things that we talked about over the course of maybe this call, as we think about data-driven decisions, really focused on what that journey and pathway looks like into HTM development, driving costs down. We'd love to have some of those conversations with this group. We'd love to plot out some of those courses for you over a period of time. But the ability to take a step back and get out of the noise from a day-to-day perspective, I think, is really important for all of us to think about as we think about what the future for our organizations look like and the efficiencies that we can truly drive. So Linda, I appreciate the time today. I appreciate what this group does on a regular basis fighting fires, and look forward to seeing you all out in the field and on phone calls to come.
Perfect. Thank you so much, Jeff, for a great presentation. Now, if you'd like more information about today's presentation and our sponsor, PartsSource, please visit PartsSource.com. Now, as promised, the answer to today's trivia question is Washington State. So congratulations to our winner, Martin O'Brien in Wisconsin. Just a quick reminder, you can obtain your CE certificate by completing the post-webinar survey, which will be emailed 1 hour after we finish today's webinar. You must complete the survey to receive your 1 CE credit from the ACI, and you'll be able to download the certificate directly from your computer once the survey is submitted. Now, if you have any questions, you can reach us at webinar@mdpublishing.com. If you've missed any of our past webinars, including any by PartsSource, please visit webinarwednesday.live to view our whole webinar archive. We'll be back next week with another webinar. So again, please visit webinarwednesday.live for more details and complimentary registration. Thank you all once again for your time today, and I hope you all enjoy the rest of your day.